Cardiologist and Executive Director of Health and Community Education at Piedmont Healthcare here in Atlanta, is joining us now with some medical insight into this news. So, sadly, cancer all over the news today. Toby Keith, the country singer, young, stomach cancer, gone at 62, and King Charles now for a form of cancer we don't know. All right. So he goes in for a benign enlargement of the prostate, and they say they found some other cancer while handling the prostate and ruling out prostate cancer itself. So my question then would be, when doctors go in to treat an enlarged prostate, when you're in that area, what other cancers are likely to be found?
So his workup would have included, digital rectal exams. They would have been able to palpate for things, of course, blood work, x-rays that would have included that whole pelvic area, but also chest x-ray as well. And the incidence of finding incidental findings on a workup, especially cancer, is about 4%. 4%
Wow.
Incidental findings for cancer. And when we look at just incidental findings overall, diagnostic tests, 15 to 30% of incidental findings, of those 4% are cancer, and of those only 10% are malignant. So we don't know what his course is, but it appears that he is receiving some type of outpatient therapy, presumably something that would depress his white blood cells, make him somewhat immunocompromised. We've all become familiar with that term, and therefore the recommendation would be that he stay away from the public to decrease his risk of getting infection while he's somewhat susceptible.
Interesting, and that's a really interesting stat you mentioned. So 4% incidental. So this does not happen a lot where they just bump into the cancer. Oh, this is also an issue. But that area, it could be anal cancer, which people remember killed Farrah Fawcett. I also heard that the bladder, it could be perhaps that, because in the same general area. Could it be the colon as well? We hear a lot about colon cancer these days, more prevalent. What if you had to guess? I know that's speculative, but anything besides the anal cancer that it could be possible here?
So 4% of incidental cancers, when we're rounding out the top 4, the number 1 is leukemia, which would be picked up on a blood exam. So 25% of these incidental cancers are leukemia. Another 15% are lung cancer. Another 13% are colon cancer. Another 9% are kidney cancer. And you can see from the top 3 of those top 4, we really don't have robust screening mechanisms for these, and so they are more likely to be picked up incidentally.
Interesting. And the fact that he's getting treatment already, does that suggest anything to you? Because you hear that, well, we started treatment immediately, makes it sound serious. Is that a fair assumption, or is that just kind of standard operating procedure?
So when I look at the timeline, January 17th was when it was announced that he had BPH, benign prostatic hyperplasia, non-malignant, was going in for therapy. Then on the 26th, he was admitted to the hospital. 9 days later, he remained in the hospital for 3 days. He was discharged on the 29th, therefore probably had some type of surgical procedure that would have necessitated him being in the hospital 2 to 3 days. And then the announcement on the 5th, which is 7 days later, 1 week later, that he had cancer, that it was not prostate, and was already involved in these therapies. So it leads me to believe, number 1, that whatever he has does not require surgery or is being staged. So the first part would include chemotherapy or radiation to perhaps shrink the tumor, and then surgical later. But certainly he doesn't have, is not undergoing surgery now. Everything is outpatient, and he's stepping away from the public, presumably to decrease his risk of infection while he is in a state of being immunocompromised or having his white blood cells suppressed with this therapy.
All that makes sense. So nothing, as a doctor, nothing struck you as particularly dire or urgent, so people shouldn't risk to think, oh, who's next to ascend to the throne, before people start playing those games. None of this struck you as a a critical, oh my God moment in terms of what we publicly know.
And so certainly there is some secrecy. They have not really disclosed what it is that he's managing. As far as we know, he's led quite a healthy life, is a robust walker, has not had health challenges, at least that have been disclosed publicly. And apparently he's feeling well and has a positive outlook. And there's something to be said in aging, and he's 75, for something called the subjective age. How do you reflect and feel and perceive yourself biologically as opposed to your chronologic age? And a lot of that has to do with your family circumstances, your sense of well-being, the value you have in your community. This subjective age is actually associated with longevity, and people who have a subjective age, which is less, meaning their chronologic age, how they perceive themselves as less than their biologic age, actually have a longevity of about 7.5 years longer. So I was happy to hear that he has a very positive outlook. Therefore, it seems to show in relation to aging that his subjective age seems to be lower than his chronologic age. So we absolutely wish him well until we get more information on what's happening with him.
Thanks for explaining all that. If there's one thing the King of England has, it's value to the community.
That's right.
He definitely has value to the community. As we can check that box. Dr. Morgan, thank you so much.
Thank you. It's a pleasure.
Absolutely. All right.